And welcome back to The Factor Uncensored. Professionals in the medical field who are always on the front lines of crisis are currently exhausted and overwhelmed. Most of their sorrows are due to staffing shortages. Dr. Danish Ali from Arch Point Pain Institute discusses the trickle-down impact of not having enough medical workers. Are you seeing this shortage after and as a result of COVID, or was this an ongoing problem in this country before COVID?
I think it was definitely an ongoing issue, Isaiah, because there were strikes from the nurses union prior to that as well. I think COVID just ignited that and catalyzed that, and lots of folks were at home, either for various reasons, not able to come into work. And then on top of that, we had unemployment stipends and things like that. And so I think it made it very difficult at that time. And now I think that we're seeing the effects of that shortage, right? And so what we've noticed is a trend in the different direction as it relates to not enough employees, not enough staff, not enough techs to help with the job that physicians and hospitals need to do. And a lot of that is also coming from the fact that it's such a stressful job that healthcare workers are in. Daily, they're seeing folks dying and very sick folks, especially in the hospital settings. And so what we're noticing is, and what we're talking about, is being more mindful of that and realizing that look at the positive, look at the ones that we were able to help. And instead of focusing on really the ones that, either passed away or continuing to get sick, really making a little shift in the mind. And even after work, just taking a break to say, hey, listen, there were people that we were able to help. And even though there were also people that we were not able to help. And so, we can't save everyone, and we try our absolute best. But at the end of the day, we have to focus on the positive and focus on all the good that healthcare workers are doing.
And what is obviously the public, we have empathy for you guys dealing in such a stressful situation and shorthanded. But what's the trickle-down effect to us as patients? If you guys are shorthanded, you guys are stressed out, what does that look like for us as patients?
Right, Isaiah. I mean, I think it turns into longer wait times. Obviously, the care also gets affected as well, right? I mean, prior to COVID, there was, like, in the hospitals, there was hourly rounding where a nurse was rounding on you consistently. Now with the shortage, where the nurses are maybe having to pick up more patients, it hinders that and makes it difficult to hourly round, for example, right? Or, for example, of getting in and changing the diapers on a patient, or doing maybe medications at a specific time. So it puts more stress, obviously, on the healthcare worker, which, unfortunately, in turn, may also affect the health and some of the care that person may be getting. And so that's why it's so important to make that shift mentally, to realize that, listen, yes, we're overworked, understaffed, perhaps underpaid, but at the end of the day, we're doing this for our patients, we're doing this for our families, and, and at that time where we're working, we're focusing on working, and then focusing on other things at other times.
All right, Dr. Danish Ali. Obviously, it's a tough time for your industry, and we wish you guys luck, because that affects us directly. And of course, we'll keep tabs on this. We appreciate your time on The Factor Uncensored tonight, sir.